So as I mentioned, we have two topics that we're going to be discussing here today. We're going to go ahead and dive into the first of those two. So if our panel one panelists can come on up. Topic one is really understanding the symptoms and health effects of your hypophosphatemia and the impacts of those symptoms and health effects on your daily life. During this topic, both from what you hear from the panel and then what we'll discuss with each and all of you, we want to understand which of those burdens and impacts have the greatest burden on your daily life and how that impacts activities in your daily life that are important to you. As part of this discussion, we want to understand how those symptoms and impacts have changed over time, as well as how they vary, whether that be varying day to day, week to week, or month to month. Also, as part of this discussion of the impacts of hypophosphatasia on your daily life, we also want to know what concerns you most about living with your condition. And so to kick us off in our discussion today, we've put together what I think is a stellar panel who will be sharing their experiences with living with hypophosphatemia in daily life. As they get settled, I'll just introduce them as a panel. We have Ramon, Kelly, Jim, Gail, and Athena. Ramon, I'll ask you to go ahead and take it away.
Good morning, everyone. My name is Ramon Reyes, and I was diagnosed with XLH in 1968 when I was a little over a year old. My mother also had XLH, and over the years she suffered greatly from its debilitating symptoms. I was rather an active kid, and although I had bowed legs, obvious short stature, and numerous dental problems, I was able to maintain an otherwise active life, including being a competitive swimmer through my freshman year in college. When my knees became so painful from the progressive bowing of my legs that I had to have surgery. Following my bilateral osteotomies at the Shriners Hospital in St. Louis in 1985, other than continued dental problems, my health was relatively good. Not much bone pain, my range of motion and stamina were okay. This general positive path of my health continued through college, law school, and into my early working life. At about 30, however, I started to notice a decrease in my energy and stamina and range of motion, and an increase in my bone pain, especially in my feet, knees, and back. Throughout this period of time, from my childhood through my early 30s, my teeth were always an issue. I can't tell you how many root canals, apicoectomies, re-root canals, extractions, and failed implants I've had. I remember distinctly when I was about 31, my right knee became so painful and unstable that I had to have arthroscopic surgery. When my surgeon met me, he said, "Mr. Reyes, when I viewed your x-rays, I figured you were a 70-year-old man. You will eventually have to have your knee replaced." This slow, gradual decrease in my health and ability to conduct activities of daily living continued. Shortly after I turned 40, I had an accident while swimming off the coast of Tybee Island, Georgia, which Dr. Insogno already told you about today, where I had to be pulled from the water, largely paralyzed. The accident revealed pre-existing XLH-related ossification of the posterior longitudinal ligament and resulted in a cervical laminectomy and fusion from my second cervical vertebrae to my second thoracic vertebrae. Thereafter, the range of motion in my neck decreased substantially. I started to experience increased mid and lower back pain and decreased range of motion due to calcification and spinal stenosis. This decrease has continued. By far, the XLH symptoms that have had the most significant impact on my adult life are the dental problems and ever-decreasing range of motion in my joints, especially knees, hips, and feet, and the joint and back pain. I cannot tell you how difficult it has been dealing with the painful dental issues I've had over the years. And that's not to say that the decreased range of motion and bone and joint pain isn't significant, because it is. Overall, my current difficulty and pain dealing with normal activities of daily living is substantial. As one simple example, the routine task of clipping the toenails of my right foot is exceedingly difficult. Combine the stiffness, pain and limited range of motion in my right leg and hip and my back, and it's just a chore to clip my toes. A more complex example is like engaging in the do-it-yourself projects at home that I've done over the years, and I've engaged in many, including 2 complete bathroom renovations, laying down hardwood floors in our living room and dining room, and rewiring the entire second floor in our house electrically. It's just getting too difficult to do the remaining projects that I have, and I have many. I can't bend, stretch, reach, kneel, lift, push, pull, or climb a ladder like I used to. It's just too difficult to do so. On my best days, things are good. My back is only minimally stiff and painful, and I can get out of bed and into my car without much difficulty. I can walk with relative ease on flat surfaces and up and down stairs without much limitation at all as to time and distance. My energy level is good, and I'm not too fatigued when I get home from work. Still, even on my good days, my range of motion is limited and I have pain. There's just no getting around the enthesopathy and arthritis. Putting on socks and bending down is difficult, and forget about kneeling, and the decreased range of motion in my neck and back is a given. These are just constant facts of life. On my worst days, getting into and out of bed is a painful chore. The car, too. The pain in my back even affects my sleeping. It's very hard to get into a comfortable position when every time that you move, your back hurts. And forget stairs. I have to take them one at a time going down and very slowly going up. Sitting, too, is difficult. My back stiffens and is painful throughout the day. And my job is a sedentary one, so it ain't a picnic. My stamina is also decreased. I just can't do as much as I can on my best days. What worries me most about my XLH is quite simple. Because of the increased debility over time, I'll become an overwhelming burden on my family. From the mid-1980s until her death in 2016, I watched my mother deteriorate because of her XLH symptoms. From a working mother, raising her own 4 children and 3 grandchildren through her late 50s, into a homebound, largely bedridden woman at the age of 65, unable to bear weight, even with assistance, let alone walk with a cane or walker, even while undergoing traditional XLH treatments. I witnessed firsthand how XLH is a whole body condition, wreaking havoc on almost every bodily system there is: skeletal, muscular, hearing, vision, you name it. Having witnessed what she went through, I fear a similar fate awaits me.
Good morning. My name is Kelly Rushing, 36 years old and from Witt, Texas. I was diagnosed with XLH when I was approximately 12 months old. There is a multi-generational history of XLH in my family on my mother's side, with an estimated 29 different cases. With this previous knowledge and my physical symptoms presenting early, my parents knew that XLH was a likely diagnosis. As an adult, I worry mostly about my long-term ability to stay mobile, dealing with pain, and staying independent. While XLH is defined as a metabolic disorder with physical symptoms, there are several emotional and mental impacts, as well as difficult decisions that I have been faced with in my life. Mobility is the number one impact that XLH has on my life. From the time I wake up in the morning until the time I lay my head down at night, I find that mobility is a constant issue. Mobility affects every facet of my life. It uses an extreme amount of energy to move, which causes pain and then causes me to fatigue. All things require mobility: household chores, shopping, social activities, just to name a few. There are social functions that I have found myself making an excuse to cancel because of the amount of energy and projected pain from the walking and or standing expected at these events. I do engage with my peers as much as possible. I find great joy in being with others, and it lifts my spirits, but it can drain my energy and cause pain. Oftentimes, it will take me several days to recover from this. I have learned to live my life of limited mobility as a balance. I would love to be able to do more activities with my husband, my family, and my friends, but without worry of how far am I going to have to walk, and how much is it going to hurt tomorrow? When deciding on a career, I had to first consider what sort of physical requirements would be expected and needed to be successful. I really had an interest in cosmetology, teaching, and possibly a healthcare profession. When observing these professions in action and noticing the amount of time spent standing, walking, and just the overall amount of energy required, I knew that the degree of my disability would just not allow me to be successful in those occupations. In one particular instance, when I was still capable of employment, I had to decline a promotion because my body could not physically hold up to what would have been required of that position. Therefore, not only limiting my earning potential, but hindering my chances of future promotions. When choosing a home, there was no way that a second story or a significant number of stairs was going to work as a manageable living environment. I would use up all of my energy just moving up and down those stairs. I actually had custom stairs built for the outside of my home. They measure 4 inches tall and 12 inches wide, creating a more gradual rise with a reinforced handrail to aid in my stability. Yes, there are more stairs total, but they are significantly easier for me to go up and down on a daily basis. In certain circumstances where there is a large step into a building with no handrail, my wonderful husband, Ricky, will automatically extend his arm and allow me to grasp his arm in an effort to provide, or his elbow in an effort to provide added stability. When out alone, I will avoid challenging steps and curbs altogether, or find a way to accommodate on the fly. Most of the time, a handicap accessible solution is readily available. However, I have encountered instances where this was not true. Being a female with a more severe case of XLH, having my own biological children was a consideration whenever I was first married. After years of deliberation, my husband and I considered that the physical demands of pregnancy, delivery, and raising children would just be too hard on my body. For me, also, running the risk of passing XLH onto my children was just too great. Even adoption was something that I felt was off the table due to the same physical demands. This choice has been very emotionally painful and is one of the most grief-filled parts of my XLH life. Having a first-hand experience in watching the deterioration that XLH can have on a body, my late grandfather slowly worsened and became homebound in his later years of life. The calcification deposits on his joints and bones had become so disabling and limited his range of motion so much he could not manage his own daily self-care. Just transferring from his chair to his bed would give him debilitating pain. Many days he would not move from his bed because of the degree of pain progressive XLH had caused him. As a person who relies on myself, I have learned to make adjustments and accommodations to suit situations and make them work for my own needs. The heart-wrenching experience of watching my beloved grandfather with a similar severity of XLH is a stark realization that the same future could be mine. It is the total loss of freedom that scares me. I am proactive in my attempts to prevent this, but as my body gets older and things wear down, there is only so much I can do to prevent it. Thank you.
Hello, my name is Jim DeBlasey. I am from Columbus, Ohio. I began to be identified as a TIO patient after many years of not knowing what was happening to me. My TIO is caused by a tumor in the left side of my skull near my brainstem. It took quite a while to connect my mobility problems and 2 hip fractures were connected to my tumor. In my early 20s, a few years after my first tumor surgery, I began to struggle with balance and unexplained backaches, knee problems, and bone pain. As time went on, I began falling on steps and even flat surfaces for no reason. I began walking with a limp, and we still didn't know what was going on. These problems began to slow me down constantly. I couldn't play basketball or soccer with my friends or move about easily in large crowds or stadiums with my family. Over the next 5 years, I continued to lose my mobility. I had to start using a walker and canes to help getting around. The doctors kept running a lot of tests on me. After they did the testing, they finally figured out my tumor caused my frail bones. The doctors said I had osteomalacia. I began to take a lot of medicine. I started taking phosphorus pills and powders, calcium pills, and vitamin D in different forms and combinations, and calcitrol, also multivitamin, and Tylenol, and ibuprofen for pain. I took medicines 4 times a day and at bedtimes, and I had to time my meds with my eating schedule to make sure they were being absorbed. This got to be very inconvenient and time consuming. I was a walking pharmacy. Slowly, some of my problems I had got a little better, but I was still struggling to get around and keep my balance, and my bones still hurt. 3 years ago, I began I became part of a clinical trial for a new medicine to help my TIO. Now I don't need to take my medicines all day long. I get one shot every 4 weeks. It's so much easier. I am feeling a lot better. I can get around a lot faster now. I am more like before I had TIO. I'm feeling more like my normal self before I got sick. Even my friends and family are noticing the difference. They're having trouble keeping up with me now.
My name is Gail Smith. I am 75 years old. It's a pleasure to be here with my husband, Roy. We live in Denver, Colorado. When I was born in 1942, there were no other cases of XLH in our family, and our daughter is the only one of our 3 children who has inherited it. And I might say she has a pretty severe case. I was diagnosed at the age of 9 at Shriners Hospital in Portland, Oregon. Twice I had both legs broken to straighten the bowing. The first one at age 18 months and the second again at age 12. I grew more after each surgery, of course, so my legs bowed again. During my school years, I always got very poor grades in gym. Because with bowed legs, I was unable to run fast or even very well. I always came in last, far behind the other girls, if I finished at all. When I was 14, our family moved from Portland to Los Angeles, and I was out of medical treatment for the next 10 years until our daughter was diagnosed in 1965. We both began taking vitamin D and phosphorus together and have been on it ever since. That's 53 years with the same medication, many times a day, as Jim said. And let's see, where did I leave off? I'm sorry. It's quite exciting now to realize that there is a new and so much more effective medication to treat this disease. My first tooth abscess happened in my early teens. I've had many more since, so I'm missing teeth and have numerous root canals with crowns. As an adult, I've always been physically challenged for stamina to keep house and raise our children. Back pain has caused bending over to become increasingly more difficult as years passed, which has made all of my duties more difficult. So my husband, Roy, does all of the heavy housework now, as well as the laundry, which is in the basement. I mostly take care of household clutter, cooking, folding of clothes, and dusting. I was a stay-at-home mom while we were raising the children, but later worked as a switchboard operator at a hospital until I retired. It was during that time that I lost hearing in one ear, and now I'm losing it in the other. We have lived in our home in Denver for 40 years. I used to have 4 large flower beds, which I could care for quite well after Roy did the digging. But as bending became more careful, I had to sit on a stool if I wanted to pull weeds. Within a few years, that became painful too, so I began sitting on the ground. By about age 50, I could neither get down to the ground nor get up again. So I began giving all my plants away and letting my gardens die out. However, this year, I just had to get my hands into the dirt again. So we created small raised beds by putting buckets on top of overturned trash cans. That brings my gardens up to my standing height and involves no bending. I'm able to work on just a few buckets at a time. The details of life changed dramatically for me actually in 2011 when I woke up one morning with numb toes. The numb, tingling, hypersensitive feeling in the skin crept upward almost to my waist over the next couple of months. It has caused me to become unsteady on my feet, and my legs are weak. In 2017, surgery on my mid-back improved the hypersensitivity of the skin. However, my feet are still painful, my legs are still weak, and I'm going to need lower back surgery. Because of these things, my world away from home has grown much smaller, and I do have physically downtime, psychologically downtimes, of missing the freedom to come and go as easily as I used to. Because I am an avid reader, I fill my time with more books than I used to. Because leaving the house is a huge energy drain, I order the books online and Roy picks them up at the library. Almost all of my shopping is now done online, and the only stores I go to are the ones that have mobility scooters available. My main concern at this time is for how well I will function in the future. Both my knees have been replaced and may need that again. I'm really hoping not to go through that. I am not on Burosumab, but hope to be able to start it soon. My hope is that it will keep me from becoming wheelchair-bound. Thank you.
My name is Athena Kinsley. I am living with XLH and diagnosed at the age of 7. I am a spontaneous case. I have a son with XLH. I would like to share a very difficult time in my life where I realized as an adult the medical manifestations of having XLH. I was raised in California and moved to Naperville, Illinois in 2012 for my husband's job. I was not familiar with snow or ice. I fell backwards on our front porch with steps in 2013. I was taken to the ER and told I did not have any fractures based on x-rays. I was given pain meds and sent home. My back and buttock area had continued exacerbated pain. I gradually started losing feeling in my right leg and noticed my foot would twitch uncontrollably as I was putting my shoes. I could not open doors, get into bed without help. During the progression of my issues, I went to several different provider specialties to get help and answers. I had low back steroid injections with no success. During this time, I was progressing to the worst. I got to the point that I had no balance and had to rely on my husband to hold on to for walking. I eventually went to a walker. After all the types of providers and treatments, nothing worked. I was depressed, scared, and desperate to get my daily functions back. I finally gave it one more chance to see a neurosurgeon to get a second opinion. When I talked to the neurosurgeon and gave my symptoms, he gave me a foot test and really heard me. It was then he recommended a stat MRI of the cervical spine and thoracic spine. He received the results the next day and called me to inform me that I need to see a neurosurgeon ASAP for surgery. He explained that I had a spinal cord injury in my thoracic spine region. During this time, I was in the process of moving back to California. I did my research and found a neurosurgeon in LA. In my search, I looked for someone that was highly credentialed with complex spinal conditions. He also was recognized as a humanitarian. I wanted someone that is good, but was also willing to listen. I went to my consultation with my MRIs and radiology readings. He informed me and my husband the importance of needing this surgery as soon as possible. I needed a thoracic laminectomy in my T7 through T10 area of the spine. He also indicated I would need a back brace during the healing process. I would plan on being in the hospital for 3 days. After my appointment, I told my husband, there is no way it will be only 3 days. I know I will be there longer. I had my surgery and ended up with a punctured spinal cord, lying flat for 24 hours in ICU. I was in excruciating pain and was in agony even with the morphine drip. The rounding physicians would see me for the first day and a half, and I kept complaining to the level of pain I was in. They informed me that this is normal and to manage it with the morphine drip and Tylenol. I was told that I would need to begin to get up out of bed and start walking. I could not manage to get myself erected out of bed to even go to the bathroom without help. With persistent fighting and pushing, I was given a consult to a pain management specialist. She did the consult with me and informed me that with chronic pain sufferers, this is not abnormal to need something stronger than morphine. She immediately started me on Dilaudid. As I began the medication regimen, I started to get up and go to the bathroom and work on getting physical therapy for treatment. During the first few days of the inpatient stay, it was then that discovered that I needed to be transferred to inpatient rehab facility. My neurosurgeon informed me that he has never seen anything like what he saw when he opened me up. He informed my husband and I that I have calcifications in my spine and my spinal cord lining is hardened. He also informed me that there are floaties of calcifications in my spinal cord that he could not remove, and they are like little islands floating in my spinal cord. I did not need a back brace due to the fact that my back has naturally fused. I ended up being transferred to the hospital's inpatient rehab for 4 weeks for occupational therapy, physical therapy, and pain management care. My husband was with me during this time. He understood the body mechanics and helped me throughout getting out of bed and going through therapy. This journey has taught us both that this disease and the manifestations that occur makes it more complex in the healing process and a considerable process for therapy, pain management, and guidance with support. I continued physical therapy when I was discharged and had to do that for months before I could even walk with a cane or eventually on my own. As I continue through my aging adulthood, I will always know that I am my own healthcare advocate along with my husband, helping me with the awareness of the complexities with XLH. Thank you.
Wow. I just want to say that it did really require the courage that Susan spoke about for you to get up today and share those stories. So please join me in another round of applause for our whole first panel.